Hello and welcome to the Headache Doctor podcast. We're on this podcast. It's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to talk about a topic I don't think I've ever covered, which is kind of silly because it's one of the most researched questions on Google as it relates to headaches. It's sinus headache, sinus-related headache, sinus pressure as it relates to your headache or migraine. There's lots and lots of people that suffer with this specific type of headache or pain or pressure or fullness, and I have touched on it potentially in other podcast episodes, but never exclusively dedicated a podcast to it, as far as I can remember, and based on what my search tells me. So we're going to hit on sinus pressure related headaches, sinus headaches. It's one of these types of headaches that is just confusing to people, and it's confusing to our healthcare system. Lots and lots of people with sinus related pressure, sinus headaches, sinus pain will go through the healthcare system looking for a solution that intuitively is screening their sinuses, looking for any sort of reason for pressure, inflammation, pain in the sinus cavities. And it'll lead them to ENTs. They'll even do invasive procedures, take antibiotics, all sorts of things to try to reduce this pain that they're having. And all the while, it could very easily and very likely is a neck-related issue, potentially the jaw, potentially the shoulders. And so we're going to look into this and try to understand why something like sinus headaches can just continue on and on without an answer, how it could possibly be related to the neck, and then why an evaluation or a screening of the neck could be prudent and wise in your search for relief. So let's just start with an understanding of the anatomy of the body and why the sinuses could at all produce a pain signal that is actually coming from somewhere else. So I talk about referred pain a lot on this podcast. It's a big deal when we're looking at headaches and migraines because pain is trying to trick us. It's trying to fool us. It's not actually its intention, but the brain is having to decipher that there's a pain signal coming from somewhere, and it gets the location of it wrong, especially when we see the intensity of pain increase. You've probably experienced that. Oh, my headache's really bad, and it went from a specific spot to kind of all over, especially with the length of time that you have headaches, meaning years, decades. The headache or migraine can kind of morph into a less specific pain and more of a general all-over type of presentation. And so when we're trying to understand, okay, my head hurts, my sinuses hurt, there's something that is actually causing the pain signal, and it's intuitive to look at that specific site. Now, when it comes to the sinuses, it's getting into a little bit different category as far as the categorization of our healthcare and the specialists that you would see. So your head hurting or your brain hurting is going to lead you to a neurologist, and the neurologist is going to look at this as like a chemical issue that needs medication in order to manipulate serotonin, things like that. When it comes to sinus pressure, oftentimes it'll lead you down the road of an ENT. And the ENT will do, whether it's imaging or look at any sense of like inflammation within the sinuses, maybe just like the volume, the space that the sinuses, are they equal? Is there a deviated septum? Is there any reason for your sinuses to have pressure, to have an issue? Now, the ENT route is, okay, the sinus pressure leads people down this ENT route. And the ENT, just like if you went the neurology route, oftentimes will come up short of any sort of objective finding in their search for the problem. Okay. And so people feel actually, let me back up just a second, because when it comes to the ENT sinus pressure route, there actually are oftentimes objective things that are found as opposed to the neurology route, which most of the time there's really nothing on imaging, clinical findings that the neurologist can come up with. And so that's why it's just like a road of medication. The sinus pressure route when we start looking at sinuses, there often is something potentially that can pop up and be like, oh, like this isn't necessarily normal. Okay, whether that's like a nodule or a little bit of inflammation or a variation in the size or a deviated septum or something like that. Okay, now what I would say is that when we start imaging just anyone off the street, they don't have to have pain. They could be a totally healthy individual. And we just start looking at their body. We're probably going to find things that are outside of what we would expect the quote unquote normal to be. Okay. Now, what we have to say is like, is that a problem? Is seeing something in your sinuses an issue, or is it just something that was there all along and is not actually connected to your headaches or migraines or this sinus headache that you're having? Well, in our healthcare system, when we find this thing that like, it's like, oh, well, maybe it's connected, maybe it's not. Oftentimes in order to treat that thing is an invasive type of procedure when it comes to something that we find in the sinuses. And so what we want to do is look at what's called a differential diagnosis, meaning if someone comes with these set of symptoms like sinus pressure, sinus pain, are we ruling out all of the things that could refer pain or be the source of sinus pain before we go down the route of assuming whatever this thing is needs to be treated with some sort of invasive, expensive procedure that's disruptive to your life. Okay. Now, that's a reasonable way of looking at it. That's how anyone who's been trained in medicine or in the healthcare system would be familiar with that model. So you come up with a differential diagnosis, you take the symptoms, you go through the evaluation process, and then you start with the most conservative, most likely scenario. So at the top of the differential diagnosis list is the thing that is most likely leading to your symptoms. Okay. Now, the differential diagnosis list for an ENT likely, now there are ENTs that are coming to understand that the neck can very easily be a source of sinus pain and pressure. I know of a few that have started to see these things and worked with good physical therapists and are evaluating the neck. And so there's potentially, and I've even interviewed some on this podcast, where they're seeing this connection and realizing like, okay, like we need to look at the neck as well. ENTs oftentimes might be a little bit more mechanically minded than a neurologist. That's anecdotal based on my experience. I don't know specifically what their training is, but it seems like ENTs, ear, nose, throat, and they have some understanding of the neck and the interaction of the neck with the jaw and the sinuses, the ear, and the pressure that can develop in the ear, that sort of thing. Okay, so ENTs can say, "Hey, let's look at the neck," and then send people down that road. But my point is, when it comes to the differential diagnosis, the neck referring pain into the sinuses typically isn't high on their list, and so there's often this feeling of, okay, we found something, not sure if we should treat it. And maybe it's even treated, but then it doesn't result in significant relief or any relief at all. And so that's the story that we're finding here at Novera when people have this sinus headache. All right, so what's happening here, and how can I help you sort of differentiate what's like a true sinus infection or pressure from something like bacterial or viral, and then what's something that we can say, hey, it's probably wise to actually have your neck looked at and think of this as potentially a neck issue. Okay, so the easy way, one of the easy ways to discern that is if you have some sort of acute illness. So if you were sick, right? If you had like the flu, if you had some bug or virus that you were fighting off, and then you have this like ongoing sinus pressure that won't really go away. And what I'm talking about is in the range of like a few weeks. There, that's the scenario where it's okay. It's tied to the specific, illness that I had, and then it sort of just gets, trapped in a sense in my sinuses, and I need some sort of antibiotic, right? To like get rid of whether it's bacterial or viral. And that's where like an ENT or a primary care doc would do a good job of like evaluating, saying, hey, this is the medication that will knock this out. And then it's cleared up, right? And so generally that scenario is not what we're seeing. Those aren't the patients that, they come in a week after having the flu and they're like, my head hurts and my sinuses hurt. Like I've actually never seen someone like that, because it's intuitive that, it's related to the illness. They have sinus pressure. There may be a sinus infection, something like that. There's inflammation occupying their sinuses, causing pressure, and it hurts. Okay. So acutely, it's pretty easy to distinguish. And then our healthcare system's pretty good at treating that. Again, with antibiotics, which antibiotics, should definitely be used sparingly, only if needed. There's implications on the gut and all that type of stuff. And so if you take antibiotics, make sure you're healing your gut, eating clean, getting the good bacteria back in there, all that good stuff. But what we're talking about here is typically this ongoing pressure in the sinuses, okay? So it's like years, definitely months at least worth of like this recurring sinus pressure. And so when patients tell us like, oh yeah, I think that's different than like my headache or my migraine, what we have to do is step back and say, well, probably not. Like the sinus issue is probably the same thing. Amanda Gerber, who I had on this podcast, she told her story, is a prime example of that. She had sinus pressure as one of her leading symptoms and thought, okay, that's separate, but I also have this neck issue, and I believe that you can help me with the neck, but I'm not, like, I probably have to continue figuring out what this sinus pressure is. But what happened is once we went through the process, like her sinus pressure cleared up and she didn't have any sinus pain anymore. And that's a very common story, okay? And so the long-term and recurring sinus pain, I would say, is more indicative, especially when it coincides with like someone who has headaches or has neck issues or you have a migraine. Oftentimes people will sort of categorize and separate the different symptoms they have. They'll say my sinus pressure is here, my tension headache's here, and then every month I get like a bad migraine or something like that, which is this intense one-sided pain stabbing in my eye, and I get nauseous and I have to lay down. Okay, so that's how people will communicate. And again, it's not like I'm being critical of that scenario. It's just in their mind, it's like three different things happening, which for the sake of treatment, we don't want three different things. And especially when it's like three different things and we don't have answers for any of them. But one of the things that leads people to take sinus pressure and put it in a different category is potentially its response to like, the change of seasons or barometric pressure. And that does make sense, because let's say you have an irritated neck, okay? And then we talk about this referral pattern. So the neck sends a pain signal, and the trigeminal nerve, which takes sensation, any sort of sensation from the face, including the sinuses, will travel through the brainstem, and it meets up in the brainstem with the neck input, and then it travels to the brain. And the brain gets the input from these locations and has to decipher where it's coming from. And that's where that referred pain comes from. The neck can mimic sinus pressure, sinus pain, okay? So when it comes to changes in seasons and allergens and changes in pressure, the sinuses are definitely feeling that impact to some extent, right? And so what happens, it's interesting, when the neck is irritated, the brain thinks that the sinuses have this pain. Then the sinuses, even though there's not necessarily like increased inflammation or any direct like objective thing wrong with the sinuses, the brain can still sort of ascribe pain to them and cause them to be hypersensitive, okay? So the sinuses are hypersensitive, even though like when on imaging it looks like everything's okay. And since since they're hypersensitive, they're going to be extra sensitive to the seasonal allergies, and then the pressure changes. Okay, so the barometric pressure drops, and then your sinuses have to relate to that. They have to respond to that, and so there's that sensitivity that's like, oh, I feel it a little bit more in my sinuses, or just the inflammation built up from the allergens causing more congestion and that sort of thing. And so your sinus pressure builds and you're more sensitive to it, okay? As opposed to someone who's going through those same experiences, seasonal environmental experiences, but doesn't have a neck issue, doesn't have that hypersensitivity in their sinuses, will likely be fine. The other element here that we could be hitting on in treatment is the ability for the body to properly drain these sinus cavities and allow fluid and mucus to move through these sinus cavities as it normally should. And so the pressure can build up when the transmission of or regulation of pressure and fluid through the sinuses is impacted, and it's negatively impacted when we have a buildup of tension through the jaw and through the neck. And it's very common for people when we're working on them to have drainage. So they feel like, oh man, I was all congested and now I'm getting a bunch of drainage that I haven't been able to get rid of. And like during the session, they feel it. I have several patients that it happens literally every time I see them. They have drainage, okay? And so what we're doing is I'm not actually touching or interacting with the sinuses at all. I'm working on the neck, reducing tension through their neck and their jaw. And that tension reducing is allowing the sinuses to drain properly. And so oftentimes when people have these neck issues, they actually have this the inability for their sinuses, or at least a restricted ability for their sinuses to regulate pressure. And so there's an increase of pressure just because they have a neck and jaw issue. And so we reduce the neck and jaw tension. They see their sinuses improve, and then they're able to regulate pressure better, and they don't have this like ongoing sinus pressure, okay? So there's the referral pain from the neck, and then there's actually a dynamic where the sinuses are impacted directly by the tension in the neck. So we have the hypersensitivity, like the brain thinks the sinuses are hypersensitive because it's ascribing pain to them, the referred pain. And then we have the sinuses actually having potentially increased pressure because they're not able to drain like they should. And so those dynamics at play make it so sinus pressure is very commonly associated with headaches and migraines. And that's where sinus headaches, we treat sinus headaches all the time. And it's not as if someone comes in and says, oh, I have a sinus headache, that we're like questioning like, okay, is this something sinuses? Is it neck? Most of the time, it's a neck issue. And so once we relieve the stress and the pressure, get their neck moving the way it should, that sinus headache almost always goes away. So it's not as if sinus headaches are this like category of headaches that's sort of outside the scope of what we're looking at. It very much is because of the reasons that I just described. And especially if when we take this information, we try to apply it to your search and your journey. What we want to do is make sure that you have had your neck appropriately screened and treated, okay? And this is the problem. Like, I wish, and I've said this before on the podcast, but I wish I could just say, like, go see your local PT. There may be a good physical therapist in your area that can, connect these dots for you. We've worked with people all around the country trying to find physical therapists that can match what we do. There's definitely elements of it. But it can be really hard to find a physical therapist that can think the way that we're thinking here. And that's why I have this podcast. That's why we're trying to get the word out, educate people. But what you can do is just understand that your neck potentially is connected, and then do what you can and do what you have control of to improve your neck. So listen to the podcast, continue to listen, get practical advice, and then know that your neck needs to be taken care of. And then, of course, reach out to us. We can take you through our virtual coaching process. We can, of course, if you come out and work with us in person, we can help you solve this problem. But we want to make sure your neck is evaluated appropriately so that we're not missing a very sort of like the low-hanging fruit, like the more obvious answer as to why you have this ongoing sinus pressure, as opposed to continuing to search for the one-on nuanced thing in your sinuses that looks abnormal and requires some invasive procedure. So we want to scan that first. And then once we've scanned neck and cleared your neck, like if for some reason you still have ongoing sinus pressure, that's when we can take this step and feel more confident of, okay, like there is something there. I will tell you that I can't think of anyone off the top of my head that like we've treated them successfully and then they still have like the sinus pressure. That's not a category we've really seen. But what I'm saying is once we take care of the more obvious, when we talk about the differential diagnosis, the diagnosis of, referred pain from the neck, like associated with the headache and migraine that you currently are dealing with as well, and the neck issue, once we clear all that up, if there's anything left, that's when you want to feel more confident, okay, I can move forward. So don't trust that necessarily the healthcare system has screened everything, because most of the people that we're working with have, they've not screened their neck appropriately, and that's why we have a job. That's why I have a podcast. That's why you're listening to this, because it's a problem that hasn't been solved, and you're likely not listening to this because you had, a fever last week, and now you have an ongoing, pressure in your sinuses, and you're like, oh, I need to figure it out, and you found a headache podcast. Like that doesn't really make sense. That's not how it operates. The reason you're listening to this, if you have sinus pressure, is because you've been dealing with it for months or years, and you have a headache and you have a migraine, and it's one of those symptoms that you've thought, oh, maybe this is different. Maybe you've worked with an ENT, or maybe just like tried to solve that with, antihistamines or allergy meds or whatever it may be. And even those things can be helpful, but that doesn't mean it's not a neck issue. And that's because of that connection with, any sort of buildup in pressure in the sinuses, like seasonal allergies. If you take an allergy medication and it reduces that inflammation or pressure within the sinuses, that would help, because your sinuses were hypersensitive, because they aren't draining properly. But ultimately, it's a neck issue. Okay, so don't be kind of fooled by that. We still need to look at this as an all-encompassing issue that can, be referred from the neck, and the neck needs to be screened. All right, so there you go. That's my evaluation, and hopefully that helps you understand sinus headaches better, and then gives you some practical things and understanding of like, okay, here's what I can do to now manage this better. But the primary sort of like the take home is, don't put that in a separate category. Understand that your neck could be involved, and let's pursue this as potentially a neck issue. Thank you all so much for listening to the Headache Doctor podcast week in and week out. What I want you to do is share this podcast with someone that you know that has headaches or migraines and needs relief, is looking for relief. Our whole framework and how we're set up here at Novera Headache Center is to help you, the individual that is suffering with headaches and migraines. Everything we do is catered to you, okay? We're not trying to convince our healthcare system. We're not trying to convince doctors that, hey, we need to have a shift in how we're thinking. We would love to do that. We would love to come to the table and have those conversations, but it's much quicker to have a conversation with you who's searching for relief. Now, what that means is we need you to help share this story and get this podcast in front of other people. So go ahead and like it, subscribe to it, leave a 5-star review, take the link and send it to someone you know who has sinus pressure related headaches, sinus headaches. Thank you all so much for being a part of this journey as we continue to move forward with the mission of educating and empowering everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.